Okay, so today we are talking about direct-to-consumer advertising of prescription medications, and this includes opioids. The first question is, should direct-to-consumer advertising of prescription medications be permitted? I do think that it should be permitted because it really does help consumers at least feel like they're getting inside scoop, or like that they're able to learn about different medications that they might be able to take for certain illnesses, conditions, what have you. So I really do love that we are like, information is so easily available to us as clients, and especially if you're really like been struggling with something for a long time and an advertisement comes up that's exactly like what you needed, and you're able to talk with your doctor prescriber about that specific medication and it ends up being like a good fit. That is just such a great way of having that knowledge and being able to like advocate for yourself, which I think it really does like allow for you to do that more, because there's more knowledge than there was before about like medications. So that's like kind of a pro on that. So yes, I do think that they should be there should be advertisements of prescriptions, particularly opioids though. No, I definitely don't think like opioids should be advertised at all. I'm thinking like diabetes medication and different like skin diseases or chronic illness, that kind of thing. Totally for. Opioids, no, we don't need to be having those on TV when we're watching the Mavericks game with our kids. That's just, I don't need to know about that. There's really only few people that would be using some sort of opioid or like really high medication, which would be like end of life care, to help someone who's in a lot of pain or terminally ill with really painful cancer or some sort of disease where it's the end of life stages. They're gonna have knowledge about probably more opioid type medications, but other than that, no one needs to know about those kind of things. It should not be available for consumers to just suddenly think that they too need an opioid to get over their anxiety. So no on that. The cons of having like so much information at our hands is we like to think that we go on WebMD and suddenly we have like 5 forms of cancer and 3 tumors and all this kind of stuff. Not the case. And so like having all this extra information is not always the best for us as consumers, and it really does lend itself to like not allowing a doctor prescriber to be the expert. It makes us as regular humans think that we are, and we're not. And so a doctor may be persuaded to give a client something that they really aren't supposed to be taking because a client is so persistent on using a certain medication, and really like this should be a conversation, but someone usually isn't going to be like, I have to take this exact certain medication at this dose. Like, that is not something that we should feel like we are doing. That should be left up to a doctor who should have the final say on what you're getting and for how much and how long, and not creating like some sort of frenzy around a certain medication that we all have to have right now because it's going to heal my whole body. So it's definitely a con of having more information out than we might have in the past.